to my channel. This is Dr. K. Welcome to the Gynae Talks. If you're new here, karibuni sana. That's Kiswahili for welcome. Mainly I talk about reproductive health and everything woman, everything to do with women, ladies, young girls, and those men who want to learn a bit more about their reproductive health and those ones of their significant others. So welcome all. Please like the button below and also subscribe to my channel. And if you're a continuing usual subscriber, please continue watching and share with your friends. To be really awesome to have this information out there with everyone else, including your family, friends, and everyone. So today I want to talk about painful sex. So if you want to listen to this, join. Welcome back, and today we're going to discuss something to do with vaginal pain when you're having sex. So I'll give you the name in medical terms. We usually call it deep Disparaeunia or just Disparaeunia. So what it means is that you have recurrent pain whenever you're having intercourse. Yani, you're having penetrative sex. So it might be just at the outside where the skin is, or right inside, or deep inside. So I'll give you a few causes, and before that I want to tell you guys, if you're watching this, please grab something, take a glass of water, take a glass of juice, because this is gonna be a little bit interesting. Really, you want to know why you're having pain during sex. So just relax and I'm gonna sort it out together. Good. So I wrote them down like a list. If you have a pen and paper, just take it down and write this list down, because it's gonna help you really, and it's gonna help someone else next to you. So number one cause of painful sex is having vaginal dryness. So basically, you know, when you're having intercourse, it's only normal to produce normal secretions. So if you don't have that, or you have dryness on the skin, then you're gonna have pain because of the friction. So that's number one. So I'm gonna go a bit faster because these ones are quite a bit of, it's a whole list. So I want you to know so that you can be able to show someone else. Okay, so number two, the other thing that can cause that, and by the way, for vaginal dryness, it might mean that you're not aroused during intercourse. So if you are having an issue in terms of maybe like if you're not interested in the person, or you're not psychologically there, you're stressed out, that can cause dryness on the skin. So that's number one. So number two, if you have any skin disorder, see now those people who have any skin disorder at all that causes itchiness down there, it can also cause a bit of scarring and healing with a lot of what we call like some kind of skin dryness. So that can also contribute to the painful sex that you're actually having. So those are 2 points. The third one, if you have any infection. So if you have any infection anywhere along the vaginal tract, either outside or inside, or right inside where the cervix is, that can cause quite a bit of pain during sex. So that's one of the things that most people will present with when they come to us as gynecologists. So most of the time we look for any infections and see whether there's anything that could be causing pain, and then we treat it, and then we see how it goes. Okay, good. The fourth one, number 4, is very important. And by the way, this is one of the most common causes of painful sex, especially when you don't have any issue around your vagina at all. And this is psychological trauma. So some people usually have this pain that is called vaginismus. So what happens, and you've had it maybe on the news, or you've had maybe some people getting stuck together in a motel, maybe it was like people say it's witchcraft or whatever. So now that condition can be associated with the feelings of guilt, feelings of it shouldn't be happening at this time, you know, like maybe if you're cheating or you were raped when you were young, then you end up having these uncontrollable contractions that hold the vagina together, and then can be associated with a lot of pain. So this is usually psychological, and this is one of the main causes of pain when you don't have any other reason like dryness, infection, or whatever. So you might want to look at your past and find out whether there was any psychological trauma that happened to you if especially if it was sexually associated sexually. So get it? Like if you were raped, you were defiled or something like that, that can give you a lot of problems later on during your intercourse. So most people, like if they were okay prior and then they have this, then they could be having other conditions that cause muscular contractions, and that can also cause pain. I think that was number 3, yeah? Number 4, yeah, that was number 4, okay. Then another reason why you would be having vaginal pain is if you have a condition that is not allowing any penetration. So for example, if you have a growth down there, like if you have cervical cancer, or if you have fibroids, or you could have any condition that causes an inflammation down there, or a growth that prevents normal sexual intercourse, that can cause a great deal of pain. So it's very possible that someone who has fibroids, they can experience pain during sex. Okay, so that's another one. So I go to number 6. If you have history of being on medication for a long time, like radiation or chemotherapy, you know, like if you have had cervical cancer that has been treated, or any other cancer where you had radiotherapy done through your abdomen and it affected your reproductive tract, that can cause a lot of pain. You know why? Because when you're treated for such conditions, what happens is that that area that's being treated heals with a lot of scarring, and it might connect with other organs around that pelvic area. So if at all there's any stretching or pulling, that can cause a great deal of pain because it does not allow expansion of that area. So that's another point. Okay, so think about these ones, like pregnant women who have just given birth and you have a tear, or you have birth injuries, that can cause a lot of pain, especially after delivery. So that is very, very important for you to note. So what we do with such women is that we tell you to wait a bit. Don't go into sex immediately. You need to give that area time to heal. Maybe you had something called an episiotomy. You were cut because of delivery by the nurse or by the doctor so that the baby can pass well. That area must be painful, you know. So wait until it heals. At least give it at least minimum 6 weeks. So 6 weeks no sex. You can't do it, by the way. You can stay without sexual intercourse. For 6 weeks, stay without sex. That's what we usually recommend. Unfortunately, we do not know what happens at home. As much as I can tell you to not or withhold sex, sometimes things happen. So if you at all go through maybe a cesarean section or a normal normal vaginal delivery, and you still and you do it way too early, then you're going to experience sexual dysfunction, and that includes a lot of pain. So it's good to give it time and then do it afterwards. Okay. Another very common thing that causes pain during sex is something called pelvic inflammatory disease. As I said, any infection can cause that. But now when you talk about pelvic inflammatory disease, this one is the one that infects the pelvic area, and that means anything around the pelvis, like the uterus, behind the uterus. So you'll find an ultrasound reading giving you had fluid in the pouch of Douglas. That means something called POD, fluid in the POD. So now that means that it could be an infection called pelvic inflammatory disease. It's a very complex condition, but can be the only symptom you can get for PID can actually be painful intercourse. So that's very important for you to know. Okay, so as I said, psychology is very, very important, and looking at your past and looking at what you've gone through as a child or what you're going through a marriage or whatever, that can cause a lot of psychological injury to you, and that can also lead to sexual dysfunction, okay? So, and in this case, the sexual dysfunction is painful sex. So we try to help you through counseling, reducing stress reducing things are like breathing exercises. You can do yoga, you can actually do exercise which can really help you. I always suggest look out for comedies, get comedies, watch comedies, always laugh, smile when you don't feel like you need to smile, but just do it. Prayer is very, very important. Prayer and meditation, I put it as one thing because it all goes in one. Meditation really helps you to relax and be able to be in touch with yourself. being able to learn more about yourself and your sexuality, and then that reduces a lot of psychological stress, especially when you're undergoing this kind of condition during when you're having intercourse. Okay, so fear and guilt, as I said, is one of those things. Shame because maybe you're too young and you're doing this, or you are meant to be with one partner but you're with another one. That can cause a lot of these problems. Body issues as well is very, very important for you to note that if you're worried about yourself, worried about your weight, worried about how you look, how you smell, how you do things, then if you have low self-esteem, this can also cause you to have painful sex, because it's all psychological. So basically all this I'm talking about is the things that are most common, but you don't realize that they're affecting your sexual life. So you need to check on these things. Relationships also matter. For example, if you are, as I said, if you're married and maybe you're stepping out, that can cause a lot of stress, and you might not know it, or maybe someone is blackmailing you. Then all those things can cause a lot of strain on you. So sometimes we need you if you have any pain during sex, and we rule out infections, disorders of the skin, disorders of the uterus, pelvic inflammatory diseases, and all those other things, then we assume that it could be psychological. So we want to look back and see, where is this coming from? Where is it rooting from? So it's important for you to check on that. Good. Wow, I think I spoke so fast, but those were the main points that I really wanted to bring out. There's so many details to each point, as I said. If it's an infection, I said there are different types of infection that can cause the pain. If it is a skin condition, those are different types of skin conditions that can cause that. So I didn't go into deeper levels, but I needed you to know what is important on the topic about dyspareunia. So when you go to the hospital, don't be afraid to tell the doctor what you're feeling, especially the point at which you feel the pain. So we might ask you, is it at the beginning of penetration, during, or at the end when they're hitting inside? So now that those things will tell us at what point or what position is the problem. Okay, so, and also talk to your partner. Sometimes some of these things can be just the way you relate to your partner. How, some people can be very, very extremely rough, so you might want to discuss with your partner to take it slow, because some of these things can cause friction and tears, and therefore a lot of pain. So if you have any questions, make sure to write to me, or you can get me on my Instagram page. That place I actually am able to reply to you all the time. Please share this video with your friends on YouTube, on every other platform, Facebook, Twitter, anywhere, so that you can be able to learn more from each other. So from Dr. K, I hope all of you have had a nice time. Let me take my sip. Oh, it's heavenly. Enjoy yourself. Bye-bye.